And good afternoon, everyone. Thanks for being here on KREM News at 4. I'm Regina on. Tim is off tonight. Well, the Seattle Seahawks got back on track today with a win against the New York Jets. This was pretty much expected as the Jets haven't won a game all season. Karthik Venkatraman joins us now. The offense picked it up today, didn't they?
Yeah, they sure did. When you win by the score of 40-3, things look pretty good. The Seahawks offense, no bueno last week against the New York Giants. However, there aren't much better ways to spark your offense and get it back on track like playing the New York Jets. They are bad, the worst team in football, and the Seahawks offense took advantage, especially Russell Wilson. He was a big reason why. The Seahawks down 3-0, not anymore. Russ finds Freddie Swain in the back of the end zone to make it 7-3. Then in the second quarter, Russ is going to find DK Metcalf. That's going to make it 14-3. And Metcalf going to get an unsportsmanlike conduct penalty, but in a very fun way. He's a cameraman now. Don't take my job, DK. Then this touchdown pass from Russ to Will Dissly. They set a career high a little later in this game. That makes it 33. This is a blowout in the fourth quarter. Touchdown to David Moore broke the single season passing touchdown career high for Russell Wilson and a franchise record for passing touchdowns in Seahawks history. What a special day for Russ in this one, as he was just magnificent. The Seahawks are on the road next week to take on the Washington football team. Regina.
Good morning. I'm very happy to be delivering hopeful news and great news here this morning for the state of Washington. I'm joyous to be able to say that the federal government has authorized the use of the COVID-19 vaccine. I'm thrilled that the Washington state has now done our review and are now authorizing the use of the vaccine, and we are ready to go.
Okay, now to our other top stories this afternoon. You heard it there. Governor Jay Inslee announcing that the COVID-19 vaccine will be in Washington tomorrow. The vaccine could be administered as early as Tuesday to healthcare workers and long-term care facility residents. Experts who tested the vaccine found it to be 95% effective. And Washington state also independently approved the use of the vaccine along with Oregon and California. Governor Inslee is assuring Washington residents that the vaccine has passed the state's independent review.
Now, given this rigorous process, I am extremely confident that Washingtonians can begin to receive this vaccine in a safe fashion.
And the state will receive 62,000 doses of the Pfizer vaccine by this Tuesday. Healthcare providers in Spokane will receive 3,900 doses of the vaccine. However, that still won't be enough to cover all at-risk healthcare workers and long-term care residents, according to the Department of Health. And in total, Washington will receive 220,000 doses of the vaccine by the end of December. Well, the Moderna vaccine is also up to be approved by federal regulators this week. Washington officials say they are very excited about the prospect of that vaccine.
We are really excited about the potential for the Moderna vaccine. There's just less logistical barriers with the Moderna vaccine than with the Pfizer vaccine. And our initial allocation is much higher. It's 128,000 doses if that vaccine receives FDA authorization for the first week, that week of December 21st.
And the Moderna vaccine could be in Washington state as soon as December 21st if it gets FDA approval. In the meantime, Coug Nation stepping in. WSU will help with vaccine distribution efforts. During a town hall, officials said they have plenty of ultra cold freezer capacity to help store those vaccines. All right, turning our attention now to the Gem State. Idaho also on track to receive at least 13,000 doses of the coronavirus vaccines. The first shipment is set to arrive this coming week. Idaho's COVID-19 Vaccine Advisory Committee recommends frontline healthcare workers caring for COVID patients and long-term care facility residents to be the first to receive the vaccine. Those in direct contact with COVID-19 patients will also be high priority for the vaccine. And the state expects to receive another 89,000 total vaccines in the second and third shipment there. Well, as the vaccine distribution process begins, we know many of you have questions. That's why we are here at KREM. And KREM, we did create the vaccine team to help you get those answers.
Can you spread COVID after you get the vaccine?
That's a really great question, and the answer is we don't know. Because we now have data to show that at least 2 of the vaccines reduce the disease caused by the virus, but we don't know to what extent infection is reduced.
So do you have a vaccine question that you'd like to ask the KREM 2 vaccine team? Text it to us at 509-448-2000 for the latest vaccine updates. You can stay in the know by texting the word vaccine to that same number there. In other news now, Dr. Bob Lutt, Spokane County's former health officer, accepted a position at the Washington State Department of Health. Dr. Lutt will work on the state's COVID-19 response team, and now we're hearing from him about his new position. While he declined to discuss his firing from the Spokane Regional Health Officer position, he wanted to thank the community for all of their support this past month. And as KREM 2's Mark Hanrahan reports, he also talked about why he decided to stay in the fight against COVID-19.
So for me, this is a job half finished. This is a book half read. And so I really want to be involved. This is my community. And I really want to ensure as much as I can as one person, the safety and well-being of every community member. To be able to do that also at the state level so that I can really have impact across the entire state. That's why I do it.
What has the last month been like for you?
Yeah, Mark, definitely it's interesting would be probably the best adjective to use. It's just, a lot of ups and downs. It just, there have been some highs and some lows. Certainly, as I mentioned earlier, Mark, the amount of support that Amy and I have received has just really helped us immeasurably during the last few weeks.
What do you think about the current situation with COVID-19 in Washington, and in particular in Eastern Washington?
It's disturbing. It's concerning. Certainly in Spokane, as you know, if you look at the curve, you've never really seen a decrease of significance. Gosh, we had a little bit of a downturn during the summer, but for the most part, we've just been on this sort of gradual rise. And then, after September, it just sort of exponentially blew up, and we continue to see a real significant increase. Spokane, but also Eastern Washington.
But do you feel like Spokane Regional Health at the moment is handling the situation good or poorly, or could they do better? What are your thoughts on that?
No, I think, irrespective of me not being there, Mark, the professionals at SRHD, they always will be doing their best work to ensure the safety and the health of the entire community. So irrespective of my absence, they're doing everything they can, but it's not just the agency. It's not just the public health professionals. It's everyone collectively that needs to be really working, because, what they're doing is providing the guidance, providing the epidemiological investigations and recommendations, but it really comes down to what people are doing.
And again, Dr. Lutz declined to discuss his departure from Spokane Regional Health District. In terms of his new role, though, he says he'll be focused squarely on the state's response to the pandemic. He says he'll be working remotely and that he and his wife are staying in Spokane.